Students, I'm going to talk about connective tissue disorders. Nobody came to tutoring tonight, so I just thought I'd make a recording for you. So we're going to primarily concentrate on systemic erythemus, lupus, and rheumatoid arthritis. I'll talk a little bit about gout. Scleroderma, the only thing I'm going to say about that is it's characterized by waxy, thick skin. Most of these autoimmune disorders have a lot of the same signs and symptoms. But usually there is like one defining characteristic that lets you know that, yes, this is lupus or this is rheumatoid arthritis. So for lupus, it's that butterfly rash on the face, the malar butterfly rash. And for rheumatoid arthritis, it is deformity or symmetrical joint deformity of the small joints, so like on the hands and feet. Okay. And with scleroderma, I told you it's waxy, thick skin. So one of the strategies you can do is make yourself Venn diagrams and put what's the same in the middle and what's not the same on the sides for signs and symptoms. Or you can make a table like I did here. I didn't fill it out. I mean, you really have to do the exercise to benefit from it. So you could put these side by side, and then what you can do is write all the signs and symptoms and then just color the signs and symptoms that are the same with the same color and figure out what's different, okay? Now with lupus, of course, it's an autoimmune disorder or a connective tissue disorder. And there's chronic inflammation in the body, okay? They enjoy periods of remission in between periods of exacerbation. And the things that usually like bring it on is like sunshine, being out in the sun, stress. So they really need to take care of themselves. So we're going to focus on systemic lupus erythemus. There's discord, and that's just refers to people who just get a rash, okay? Risk factors, prolonged sun exposure causes an exacerbation, but can also bring on lupus, okay? Signs and symptoms are going to be the same, I said, in most connective tissue disorders. So the malar rash we talked about, it's the butterfly rash you see here. That is very common. They'll have serositis. Serositis is inflammation of the serous membranes in the body. So that's why they get pericarditis, pleuritis, pneumocystis. So just basically they get long-term sequelae from this. All right, they can have oral ulcers, arthritis, so joint pain is common, anemia, they get pancytopenia, they can't get that. And as the disease progresses, they get more photosensitive. Okay, so that could cause an exacerbation as the disease progresses. They can have develop chronic kidney disease from this. And we talked about pancytopenia when we talked in the cancer lecture. So that's a reduction in red blood cells, platelets, and white blood cells. All right. Anybody with an autoimmune disease can develop something called Raynaud's phenomenon or Raynaud's syndrome, and sometimes it's referred to. And what happens? It's due to arterial vasospasm. It's highly tested on ATI. And so what happens is the skin on the hand changes colors. It goes from white to blue to red. Okay, you need to tell the patient not to elevate their hand when this is happening because that's going to slow down the blood flow. And it's usually in reaction to things that make you vasoconstrict, such as nicotine, caffeine, being out in the cold can bring it on. So they need to, stay warm, wear lots of clothes, etc. They can order medications for it. Calcium channel blockers or other vasodilators to kind of prevent and take care of it. Here's a picture of the malar butterfly rash over the face. As a nurse, we always want to monitor for pain, immobility, and especially fatigue. They get very fatigued. They need to alternate periods of rest with activity, but they're going to be at risk for chronic fatigue. Okay, so you need to watch out for that. We want to make sure we're medicating the patient for pain if they're hospitalized. We're going to look and make sure they don't have acute kidney injury or chronic kidney disease yet. So they would be watched by their provider. They would have probably an annual creatinine, BUN and creatinine. We also want to make sure we're listening to their lungs. Okay, medications are going to be on. Okay, NSAIDs. I talked about this in the peri-anesthesia or care of the surgical patient, that NSAIDs are held for 7 days before surgery. So an NSAID would be like Advil. All right, or sorry, ibuprofen. That's an NSAID. All right, non-steroidal anti-inflammatory drug. Okay, so there's a bleeding risk and it causes sodium retention. So they are on these medications, so you have to watch out for that. Corticosteroids, an example of a corticosteroid would be like prednisone. These increase blood sugar. So that's important to know when somebody's on them. And they increase appetite. So people often gain weight when they go on corticosteroids. It increases your BP and increases your risk of getting infection. All important points. They go on immunosuppressants and antimalarials as well. So we have to make sure we're stressing the importance of the medication regime with them. Again, client teaching, stay out of the sun, okay? They need to report flu-like symptoms, and they need to take care of their skin. Stay away from crowds because they're going to be prone to infection. For Raynaud's, they need to wear multiple layers of clothes. They should walk to promote circulation or do some kind of exercise. They should not elevate the extremities. I talked about that. Avoid the triggers and don't touch cold objects. So I had a friend whose mother had Raynaud's, and she had to put on gloves to take anything out of the freezer because she couldn't use her hands for a while, after she had an episode. All right, the next thing is gout. Now, gout, the difference between gout and like some of the other diseases that affect the joints. Gout typically only affects the big toe joint. Okay, so it's a systemic disease. What happens is that the patient experiences hyperuricemia. Okay, and so these uric acids uh, get into the joint and cause pain, severe joint pain. So they need to be on a low purine diet. And what that means for you is they need to stop eating organ meats like heart, kidneys, liver, brain. People don't usually eat brains, but because it's dangerous for another reason. But they need to stop eating organ meat and shellfish. Okay, everybody needs to limit alcohol and adhere to their medications. Okay, fibromyalgia. I'm not really going to say a lot about this. They think it's an autoimmune condition. The only thing is that they have hyperalgesia. So and they feel pain to responses that you don't really think are going to cause pain. Like if I touch somebody on the back, they might be like, "Oh, that's painful." Okay, so we're not going to really get into this too much. Okay, rheumatoid arthritis. Okay, white blood cells attack their joints. It's symmetrical. It's on both sides of the body. Okay, and they also get exacerbations or remissions, just like every other autoimmune disease. But this is like the way their fingers look. This is called swan neck deformity. Okay, now the hallmark of this, or one of the hallmarks, is that they're going to have early morning stiffness and an elevated temperature. So people with autoimmune diseases should take their temperature every day, just like somebody with HIV. Okay, I talked about it being symmetrical. So the labs, they're going to have a high white count, and this could happen in any autoimmune disease. Any autoimmune disease could have a high white count, C-reactive protein, elevated SED rate, anti-nuclear antibody titer could be elevated, and rheumatoid factor could be elevated or present. Okay. Nursing care with people with rheumatoid arthritis, you do want to encourage movement. The muscles need to be warmed first. So when patients with rheumatoid arthritis get up in the morning, they're very stiff, and it takes them a long time, like a couple hours it could take them to get going. Okay, so you have to remember that. Warm up the muscles, a nice warm bath before they go for a walk, a cup of hot tea they can wrap their hands around to kind of warm them up. You need to encourage assistive devices because we always, always, always want people to be independent as much as possible. So we want to promote any kind of device that is going to help them be independent. We want to make sure the environment is safe. And they're on some of the same medications. So remember, the corticosteroids can increase your blood sugar. and NSAIDs can cause bleeding. Um, Also with movement, okay, encouraging movement. Of course, you want to encourage movement, but if the patient is in pain, they don't need to exercise that day, okay? If they're in pain, you never want somebody, if they're having joint pain, to kind of push through that pain, okay? Because you might do more damage to the joints. Definitely, they like heat. You can apply cold too, but heat is really going to help. Um, Pain in the hands, they can use warm puffer and waxes. I don't know if you've ever had that with a manicure, but feels fabulous. And if they're get edematous, they can use cold therapy. They need to report a fever and infection, and I already talked about alternating periods of rest. All right, so let's talk. Let's kind of review a little bit with autoimmune, okay? All right, so rheumatoid arthritis, you need to know the early morning stiffness and the erythema of the joints and the symmetrical and its warm joints. Okay, so they may be red, they may have a fever. Okay, they're going to be prone to Raynaud's, just like people with lupus. All right, dry mouth, everybody with autoimmune disease get that. Now you need to know these labs that everybody with a autoimmune disease gets. So high WBC, C-reactive protein, the ESR, all these, okay? You need to know that. Encourage movement, I talked about that. You're going to collaborate with OT to help with the ADLs, PT to help with movement, and dietary. You want to facilitate use of assisted devices. I talked about that. Make sure the environment is safe, especially if they have rheumatoid arthritis and the joints are deformed on their feet. All right, so your goal is always going to be to promote independence. All right, so key teaching. This is so important, okay? So exercise daily as tolerated. Again, remember, don't go past the point of pain. They don't need to make up for lost time because exercise is good for them, keeps them mobile. But if they didn't exercise for one day, it doesn't mean they do twice as much the next day, okay? Heated paraffin for the hands, warm bath, daily temperature, and report if needed. They need to conserve their energy, and they do that by alternating periods of rest with activity. And they need to adhere to the medication plan, just like people with lupus. All right, with gout, it's only one big joint, high uric acid, high ESR, high BUN, and creatinine, okay? Patient teaching, this is important. So low purine diet, no organ meats or shellfish, okay? That's important. They need to adhere to their medication plan. Lupus. Okay, so with lupus, the mallow rash is the defining characteristic. The other thing, they're going to be prone to Raynaud's. They're going to have pancytopenia. And remember, they really shouldn't be in the sun because it could aggravate or bring on an episode. So they're going to need teaching about that. Remember, Raynaud's is also a complication. Okay, for teaching, you're going to tell them to minimize lab sun exposure. Okay, use SPF, always 30 SPF. They need to report flu-like symptoms because it could mean they're having an exacerbation. Okay, you want to monitor for pain and medicate them if they need it, if they're in the hospital. Monitor for renal failure and teach the importance of med compliance. Raynaud's, we went over that. That is highly tested. I would know all these things about Raynaud's, okay? So wear the multiple layers of clothing, walk several times a day, etc. No smoking or nicotine, and don't elevate the extremity. All right? So make sure you remember all that. What's over here? I don't know what that is. Okay. All right, so let's talk about anaphylaxis. Oh my God, my mouse isn't working. Sorry. Okay, with anaphylactic reaction or shock. Okay, so the signs and symptoms, usually it's an allergy. Somebody's allergic to something and they have a reaction to it, okay? So you're going to see hives, which is called urticaria, angioedema, which is swelling underneath the skin, and we really worry if it's like near the throat or on their tongue, right? Wheals, tachycardia with decreased amplitude. Okay, so the normal pulse amplitude is +2. So if something says decreased amplitude, that means +1. Okay, if it's above +2, that means the pulse is probably bounding, so +3 or +4. Okay, they're going to have hypotension, bronchospasm, spasm or constriction, which is what we worry about. We worry they're going to stop breathing, right? Wheezing and itchy skin. Okay. Um, Complication, shock, and death. So we definitely want to prevent that at all costs, right? And then it's diagnosed on the signs and symptoms. Okay, so your main goal, if somebody is in having an anaphylactic reaction, is to make sure the airway stays patent. Okay, so you're going to administer oxygen. Okay, you're going to make sure they have a patent IV. So get that IV in quick. Make sure you've done a good job. Make sure it's a 20. And they need epinephrine because that opens bronchial tubes and increases BP. Here's the thing. Do not fall for this. Only dead people get epinephrine IV. And I'm going to tell you why. The medication that we give IV has a very strong concentration. So people that are still have a heartbeat do not get IV epinephrine. They get subcutaneous epinephrine, but they do not get IV epinephrine. Okay, because it's only for people that don't have a heartbeat. Okay. The other thing too is, like, I think I've told you this before, mental health support. If somebody is having trouble breathing, they're going to be super anxious. Do not leave them alone. You call for help and try to calm them down. Do not get anxiety yourself, because anxiety spreads, and so you got to try to really stay calm. All right, patient teaching. You're going to have to teach them how to use an EpiPen and to carry it with them. Okay. All right, let's go on to HIV. All right, with HIV, okay, so HIV, how it's transmitted, usually through, sex, through semen and vaginal fluids. So you need to know that it's they're infected through blood and body fluids. Okay, so what typically happens is somebody's exposed, and then 2 to 4 weeks later, they feel like they have the flu, and they probably forget about the incident that caused it. So sometimes people are taken by surprise when years later they're told they have HIV. All right, so they're gonna, get fever, night sweats, sore throat, and a rash, and they'll have lip adenopathy, which means swollen lymph glands. Okay, then they're gonna be asymptomatic for 10 years. Then, if they develop the opportunist infections, like they weren't on the antiviral treatment, they could develop these opportunistic infections, and then that's when we say they have AIDS. Now, I graduated nursing school right when this came out. Okay, so 1987. And at that time, we didn't have all this wonderful medicine, and people were dying a lot. It was very sad. I took care of a lot of young people that died from this disease, and I'm so grateful for the medicine we have today. All right, so the complications. These are the opportunistic infections. Okay, tuberculosis, and we're going to talk about this during the when we talk about pulmonary diseases. But fever in the afternoon and night sweats, that is 2 key symptoms of tuberculosis. They can also get this Kaposi sarcoma, and I have a picture of this I'm going to show you, which is red and purple lesions on the skin or inside the mouth, and they're supposed to be painless. Wasting syndrome, super important for you to know. What happens is they get massive diarrhea. They have mouth ulcers that are really, so it makes it hard for them to eat. They have fat intolerance causing diarrhea. And then they have unintentional weight loss, which is like everybody's dream to lose 10 pounds without trying. But really, it's not a good thing, okay? And that's going to make them prone to malnutrition. All right, so, and they're anorexic too when they get wasting syndrome. They can't eat. So for anorexia, do not give fluids before or with meals, okay? Provide supplemental, meals, snacks, and vitamins in between meals. And then malnutrition puts somebody at risk for neutropenia, so we want to watch that. A CD4 level less than 200 means they're going to be at risk for infection. So those are key points, right? Now, you need to know all these teaching points, okay? Super important, okay? You're going to teach them to do a daily temperature, report any signs of infection, use antimicrobial cleanser to wash their axilla and genitals 2 times a day, okay? You want them to bathe using antimicrobial soap, like what I talked about with the peri-anesthesia lecture before surgery. People wash with antimicrobial soap, same thing. No fresh flowers or plants allowed in their room, okay? Because they carry bugs. No fresh fruit, I already said that. Okay. Wash dishes in hot, soapy water. They need to wash their hands frequently. No raw or undercooked food. All food has to be canned or cooked fully. Do not handle cat litter, even with a mask and gloves. Cannot handle cat litter. Stay away from sick people, Avi, and avoid crowds and make sure they're adhering to the medication program, so med compliance. All right. You want to limit visitors into their room if they're in the hospital because they're really prone to infection. Okay. So here is, I wanted to show you some pictures. This is Kaposi sarcoma. It's got the red and purple lesions. They're supposed to be painless, but it indicates that they have developed this cancer, Kaposi sarcoma. And then wasting syndrome. So again, 10-pound weight loss, diarrhea, anorexia, mouth lesions, and they're at risk for malnutrition. Okay, those are some important characteristics of HIV. Okay, I'm going to stop there and do another video later.